Today we're going to videotape the injection of a filler, calcium hydroxyapatite. Lois has agreed to allow us to film today, and I'm going to start out by going ahead and just marking the areas where we'll use the radius filler. Remember, radius is probably for deeper planes of skin injection because it's white. If you inject it too close to the surface, it will actually be visible through the epithelium of the skin. Smile for me. Okay. You see she has some fixed medium lines, and I'll just relax, forming there. And I'll just put the accentuation there. And her nasolabial creases are the cheeks that she actually dislikes the marionette lines even more, so maybe open just a little bit. And now smile for me. Now pucker up for me. And you can see that line kind of extends up with a smile, it goes down, dynamically goes down that way a little bit further. Likewise on the other side, smile for me. Relax. Smile for me. Pucker up. Relax. And then I also like to go to the base of the nose and fill in a little bit there. Sort of like a triangle. Come across there, fill the depth there, and then open for me. And then here, there'll be quite a bit of filler put right in that area there. I'd estimate that we'll probably use 1 cc or 1.2 cc's of filler on each side in the process of doing the fill. So what I have here is a connector, female to female, so the male end will go in. I'm going to take some xylocaine with epinephrine and some bicarbonate, and I'm going to mix it with the calcium hydroxyapatite that's in this syringe. So I'm going to take and drop 0.2 cc's of the bicarbonate and 0.4 cc's of the xylocaine with epinephrine. I'll then take and put that to the connector. And we're going to mix the xylocaine and the bicarbonate with the radius. And just do that by plunging back and forth, a little bit at a time, so that you get a good mixture. I'll go back and forth at least a dozen times. And what you want to remember is that in this circumstance, the radius is diluted. It's therefore easier to inject, but you need to overcorrect for volume because the volume has been expanded by as much as 30 or 40%. Therefore, when the xylocaine with epinephrine goes away, the volume will be less, and therefore remember that as you do the injection that you probably need to inject whatever volume you anticipated needing. Like this is really 0.8 cc's of calcium hydroxyapatite, even though the volume that I've filled it up to is 1.2 cc's. I use a light alcohol prep. I like to use a sterile glove in my left hand because that's against the injection site, and then I like my right hand to not have a glove on because I have better tactile feedback from the syringe on how much fill I've put in and where the resistance is for the needle. Then we're going to go ahead and start the injections, and if you'll ice for me, Sherry, I like to ice a little bit. We'll take some of the sting off. Remember, this has local anesthetic in it, so that I'm going to make one pass with the filler and local anesthetic, and then wait a little while for the local anesthetic to take effect. Mm-hmm. So we've waited for the local anesthetic to take effect. And I'm going to use a 27 gauge 1¼ inch needle for the injection. You see me here making passes along the nasolabial crease, and I'll inject as I withdraw, injecting about 0.1 to 0.15 cc's with each pass, probably 2 or 3 passes along the concavity of the nasolabial crease, and then also accentuating perhaps 0.15 cc's of extra material at the base of the nose. Here I've begun the injection into the marionette lines. And notice the needle is located in the deep dermis. You can't really see the tip of the needle. You can kind of imagine where it is, but it is on a deeper plane. If you go too superficial, you're going to see the white material through the epidermis. Here I'm doing some little spots, just spot fills. The filler out a little bit. Feeling for any places where there's extra filler that I want to smooth, or where there's places where I could, even if I have to back out, I don't feel any of those today. When you want to back out the filler, you use like a 21 gauge needle and you make a poke over where you have extra filler, and you can just squish it out and squeeze it back out. And with the calcium hydroxyl apatite, you want to do that within the first day or so, because after that it begins to get incorporated, and it's hard to have it back out after 2 or 3 days. Now in the corner of your mouth, Lois, you're going to feel that sticker there because I put a little bit more in there.
Okay. Kind of moves around and flattens
It doesn't
out.
move, it flattens out.
Flattens out?
Yeah, flattens
Okay.
out. And remember, you can do that. If you feel some lumpy, bumpy things or something like that, it's just good to
So just kind of check like you did with your
exactly.
finger inside your mouth.
Yep, exactly.
Okay.
Okay, you may get a little bit more swollen yet today.
Oh, wow. Okay. Wow. Looks good.
Yeah, a couple
It'll
of
look-
bruises
yeah.
to camouflage that for me, and
Okay.
thanks for allowing us to record, and we appreciate that.
Welcome.
So our patient's back this morning. How did the injection go?
Good. Looks good.
And she, and I'm happy that it looks good from the standpoint of symmetry, but we got quite a bit of bruising on the one side, and down here by the marionette line, you can see the bruise that happens there. These bruises will be covered with makeup, and they'll take at least 10 days to subside and disappear. Smile, pucker up, relax.